Good afternoon, everybody. My name is Alejandro Garcia. I'm the Communications Director for Attorney General Ken Paxton. I'm going to go ahead and introduce Attorney General Ken Paxton. Will give brief remarks, overview of the issue of the settlement, and then we'll go ahead and pass it over to Suzanne Jarvis, and she is the Director for Development and Analytics in the station. And we have also Paul Singer with our office. He's one of our Assistant Attorney Generals for civil litigation, and he is heavily involved as well with the opioid settlement. So he would be answering all the questions, if any, regarding specifics on this topic. So I'll go ahead and now introduce Attorney General Ken Paxton.
Well, thank you, Alejandro. Thank you all for being here today. Unfortunately, the opioid crisis is not over. And last year was one of our worst, with deaths up over 30% nationwide and in Texas. In 2020, 93,000 people died from opioid overdoses, nearly 30% more than the year before. This number is significantly less than the number of families that have watched their loved ones live with their lives torn apart because of the opioid crisis. This historic $26 billion agreement, which was actually announced on July 23rd, will bring desperately needed relief to Texans who are struggling with opioid addiction. The agreement includes Cardinal, McKesson, AmerisourceBergen. These are the nation's three largest pharmaceutical distributors, and Johnson & Johnson, which manufactured and marketed opioids. This settlement, again, is $26 billion nationwide. $21 billion is from the distributors that I just mentioned. Another $5 billion is from Johnson & Johnson. The state of Texas is joining the distributor deal. We are still evaluating the Johnson & Johnson piece of this. The agreement also requires significant industry changes that will help prevent this type of crisis from ever happening again. J&J is actually getting out of the opioid business for 10 years, and the opioid distributors are creating a nationwide clearinghouse to monitor drug diversion. The maximum amount of money for Texas is almost $1.5 billion. A majority of this money will go to opioid abatement and to local government entities to address the opioid crisis. The money will be able to be spent on expert-approved abatement strategies to be deployed around the state. This is a good deal for Texas, for its cities and its counties, and really for all of the citizens of this great state. This deal delivers funding right now to our state and its communities. We desire for our cities and our counties to get behind this deal to maximize the money that can come to Texas citizens who need it. If cities and counties decide not to join this deal, Texas will receive no real money now. The cities and counties with trial dates have no guarantees of a trial, and they have no guarantees of any money. And one thing they are guaranteed is a long, drawn-out process, which doesn't allow the people who need this to get it. We end up not maximizing for sure the money that all Texas citizens have the opportunity to be a part of. The time is now for action, and we must maximize our recovery and take care of our citizens so that we can serve as an example for the rest of the country. So we're asking our cities and counties to thoughtfully look at this and to join a deal that we've spent years negotiating. And this will only be the beginning in our battle to combat opioid addiction. We will continue to fight, and we will continue to go after these other companies, along with some of the manufacturers that are currently in bankruptcy. And so you will see our office continuing to seek resources from these companies that have caused this problem. So with that, I'll turn it over to Suzanne, wherever she went.
Suzanne Jervis. Thank you, Jeremy.
Okay, welcome to the Houston Recovery Center. On behalf of our staff and Leonard Kincaid, our director, who couldn't be here today, it's actually great to see some community faces. We haven't seen each other in a while. So I am the Director of Data Management and Program Analytics, and I get to see a very, very unique view of our service model and what we do here. So what I'd like to do is briefly show you what we do, what we see, and why this money is so important. And thank you so much for your time to come to our center and for all of your efforts in bringing this money to the people of Texas, because it is so desperately needed. The Houston Recovery Center specializes in addiction recovery. And what that means is we have conversations with folks that are actively using substances and are not yet thinking of changing their lives or their usage patterns. And these folks are using at a level where they're crossing into safety and health issues. And so we call that harmful and hazardous substance use. And when we find folks that are ready to take action and recover, we pair them with a recovery coach who's in recovery and is certified by the state, along with a case manager, and they create a plan with the person. They help them get access to treatment and services, and then they help them manage the recovery process directly in the community. And so we have to reframe what substance use disorders look like. We have to frame it as a chronic health condition, because this is what healthcare does with their chronic conditions. If you have cancer, you go in and you get a 5-year plan. You get all the assessments, you get all the labs, you get all the treatment, you get all the follow-up, and they follow you for 5 years to see if you're cancer-free. And when you get to 5 years and you're cancer-free, you're in remission. Well, the same process happens with recovery. So what we try to do is get a benchmark of working with folks for 18 months, and then once they reach like a 5-year benchmark, they're considered in long-term recovery, and they can maintain that recovery. The numbers of going back to use drastically reduce when you get to that point. The populations that we're serving are complex. They have complex needs. Their stabilization time is much longer. So we have clients that have stayed with us for 7 years. We are housed here with the Houston Police Department. Good to see you again. Our operations for our sobering center are below us. We opened in 2013. We've served over 35,000 people. And we learned from our clients. So 90% of the folks that come through our sobering center, they come for a short-term stay through law enforcement diversions. We only see them one time. But 10% cycle through on a regular basis. And so we just developed a recovery program for that population. Once we got those two pieces in place, we started saying, who else is seeing this population in the community? What other stakeholders are working with them? And so we partner with the county, we partner with the city, health department, and then we partner with the hospitals. And we work to stabilize all the folks that are cycling through our system. So we're in Harris County Jail, we're in the diversion courts, we're in adult probation. We're working with Harris County Public Health now on an opioid intervention in the jail. And then we work with the Houston Health Department and the Houston Fire Department on an opioid initiative called Frontlines. And we send our advocates to 36 different hospitals for folks that have been diverted for opioid use disorders, opioid overdoses by EMS, and we meet with them there. And we work with the Harris Health System, working to help them manage the frequent clients that are going through their emergency department. And we're doing street outreach as well with the downtown and midtown management districts with our pit van. We cast this huge net. We see it systemically. When you see things systemically, you see where it works, you see where it doesn't work, and then you see the opportunities and you see the barriers. And what we're starting to do now is we're starting to try to reduce the redundancy of folks cycling through services. And when we do that, we reduce the waste, and then we get rid of the collateral costs that this population creates, which is really, really high. When it comes to opioid use disorder, I looked at the data before I came here on the Frontlines project, and I've been involved in substance use my entire life and my professional career. And I was floored because what we're seeing in that data is an age range of 14 to 91. And when I saw a 91-year-old female overdosing in her home, I was like, what is going on here? And there's a significant number of senior citizens that are overdosing in their homes. And so what's so important is for us to reframe how we see people with substance use issues. And so the industry is rapidly changing. I can't tell you the new formulations that come out, the new combinations of drugs that come out, how people use it. And so we are so grateful for this money that's coming in. I can't tell you, substance use money comes in with a lot of restrictions. But it seems that this money that's coming in, we will, as a population in Texas, be able to define how those funds are distributed. And it's my hope and the hope of the stakeholders that we're involved with, that the council that you're putting together to manage the funds, that we have stakeholder information and involvement in the say of the decision-making of how this money goes. So if we see it differently, if we reframe it as a chronic health issue, and through the power of collaboration, we learn, we grow, we get smarter, we do it better. And with these opportunities, we have an exciting opportunity ahead of us. So it's a pleasure to talk to you today. Thank you.
Thank you, Ms. Jarvis. Now I'll introduce Associate Deputy Attorney General for Civil Litigation, Paul Singer. Any opioids-related questions he can answer? We're just going to take 2 or 3 questions, and then we'll wrap it up.
Good afternoon, everybody. Happy to take any questions. So we certainly have seen an increase in opioid abuse in Texas, just like the rest of the country has. This past year, we saw an almost 32% increase in opioid overdose deaths, which is kind of shocking considering the efforts that have been put in place over the past several years to both try to educate everyone about this crisis and the dangers of opioid abuse, and also all of the abatement strategies that have been put in place. And it really underscores the value of this settlement that General Paxton is joining today, because it's going to bring money into the communities right now. So cities and counties that want to participate can get access to these funds and are going to be able to put the kind of programs in place that you just heard about that can make a real difference in this crisis.
Is there a timing to when we'll receive the funds?
So money will start flowing out of this settlement in the early part of next year. But obviously, there's a number of factors that have to go into making that happen, and there's a number of factors that go into how much comes to Texas. And the most important one for both of those is whether cities and counties in Texas join into this deal. That we only get the money and we only get the treatment efforts if cities and counties participate in this settlement. And so that's why we're here to try to encourage everyone to join, stand behind General Paxton, and get on board with this deal.
I know Attorney General Paxton has been working for years on this, so I'm just wondering if you can explain the process of how this started. So there were smaller stakeholders involved who were suing or still suing, and so you decided to take the initiative, create a settlement. So now you're opting, or you're allowing other people to opt in to participate. Can you just describe what the impetus behind this was and what the crisis was you're seeing, and how, I'm assuming that there is no other settlement like this that's ever happened before in Texas or in any other state, so could you speak to
No,
that?
that's a great point, and yes, happy to. This is nationally the largest state-driven settlement, right behind the tobacco settlement from decades ago. This $26 billion deal represents a massive settlement unlike any other. It is absolutely historic. And it really started when General Paxton came into office and saw this opioid crisis and saw this uptick in lawsuits, as you mentioned, that started to happen throughout the country, where cities, counties, states all started bringing action against opioid manufacturers, distributors, pharmacies, everyone in the supply chain for their conduct that led to this crisis. General Paxton recognized at a very early point that the only way we were going to abate this crisis was to get everybody together and try to find a way to fund abatement programs for the future. So he worked with his colleagues throughout the country, pulled together a group, and was able to negotiate this historic settlement that has the opportunity to deliver the funding that we need for these treatment programs.
Hey, tell them about the bankruptcy concerns if we don't get this done.
No, that's a great point as well. Right now, we are active participants in 2 bankruptcies in the opioid space with Purdue Pharma and Mallinckrodt, and those bankruptcies are a cautionary tale. Any of these companies that have to go to trial and facing the weight of these thousands and thousands of cases throughout the country can very easily be put into bankruptcy. And when they go into bankruptcy, everybody loses. We're not going to have the kind of funding available to us that we need. And the citizens end up losing because we're not going to be able to get the treatment out that we need to see take place. And so our encouragement of cities and counties to join is really driven by this desire to keep them out of bankruptcy and make sure that money can flow into the community where it needs to go.
So if Texas hadn't taken the lead, it's possible this could not have happened.
I absolutely believe General Paxton led this effort and got this historic result. I think that is a very true statement, that without General Paxton's leadership, this deal couldn't have happened.
Can you tell us a little bit about what the clearinghouse is or what that would look like?
Sure. So the clearinghouse is going to be created as part of the distributor settlement as an independent third-party body that's going to receive all of the information about pills shipped into areas down to the pharmacy level. And the point of this was because it's solving a problem that we recognized very early on that the distributors had, which is that they can't share information with each other about where they're shipping pills. So pharmacies are able to purchase from one distributor, switch to another, and it won't raise any concern or red flags. This clearinghouse is going to function as a way to pool all that information, identify problems quickly and early, and then force the companies to actually take action as soon as they identify a problem.
We'll open it up for one more question. If not, only once, going twice. That's it. Thank you, Mr. Singer. Appreciate it. Thank you very much, everybody, for coming. And if you have any questions about this issue, you can go to our website, and we will have more information on that. civil litigation.